Good morning. Assalamu alaikum. Welcome to another episode of ShuraTV health program. I am Dr. Zachariah here with you to explore different subjects and different issues in health so that we can be more aware and cognizant of our health and be advocates for our health ourselves. We are here in the midst of the beginning of summer. Summer's starting here in Southern California. The weather is very sunny and warm. It's about 80 degrees. And I just wanted to, and a lot of the schools are out, the kids are home, and they're doing their camps and schools and things like that. And I wanted to just remind you that make sure that you get for your children and for yourself water dense fruits and vegetables so that you're hydrated during these days, because it is getting a little warmer and we tend to forget to drink our water. So therefore, we want to make sure that we get enough liquids in our body so that we're hydrated so we don't get any illnesses. So that's something very important. Watermelons, strawberries, melons, other types of cantaloupe, anything that you can juice, you should be buying for the summer. And then especially anything that's seasonal and that's juicy for your children, and they'll enjoy it. Today we're discussing heart disease, and we've discussed this one other time where we classified the diseases and the different types of heart disease. Today, we're just going to go over some statistics and some general information on what to do to prevent ourselves from getting heart disease. As you may know, heart disease is the number one killer across the globe. So that's a staggering statistic to keep in mind. It's also the number one killer of women still in worldwide in terms of a disease. So it surpasses breast cancer, as well as other forms of female pathologies. So heart disease is something that's very important. World's number one killer. About 19.6 million people per year suffer from heart disease. And that's something which is cardiovascular disease in general. When we say heart disease, we mean issues from the heart emanating from the biological structure itself, as well as the arteries and veins. So this is the whole vascular system, and the whole mechanism of the vascular system, the whole purpose of the vascular system is to get blood, oxygenated blood to all your tissues and organs so that it can function properly. So therefore, if this system is dysfunctional, there might be some parts of your body which are not getting the optimal amount of oxygen coming to it. And this is something which is important for healing, for sleep, for longevity, for normal functioning of hormones in the body. So it's a basic building block, the cardiovascular system, which affects all aspects of one's lives. So if people are getting plaques in their arteries, this is very dangerous because it could emboli into the lung, and you can have a pulmonary embolism. It could go to the brain and cause a stroke. It could go to the heart and cause a heart attack. So, or it could go to, down into your legs and to your other organs, and it could cause a blockage of the blood going in. So therefore, that organ will suffer, and you'll get cramps, and you'll get organ dysfunction. So these things are very important to keep in mind. It's very important. So that's something that you have to keep in mind. Getting back to the statistics, so it is the number one killer in the world, and the attribution of diet is something which is very, very, very important. And we usually talk about heart disease in terms of cholesterol. People focus a lot on fat a lot, on cholesterol, on processed fats, on bad fats that people might be getting. But the other comorbidity with heart disease is sugar. So people who have high sugar or diabetes are 3 to 5 times more likely to get a cardiovascular pathology or an event, meaning stroke or heart attack or things like this. So if you do have diabetes or if you think you're on a high sugar diet, you're drinking a lot of soda pop, you're drinking a lot of juices that have added sugar, those you have to stay away from because those increase the chances of cardiovascular disease, as well as weight gain, and as well as um, uh, burdening the kidney and livers. Uh, Burdening the kidney and liver to deal with that excess sugar and high insulin in the body as well. They get a lot of those people that consume lots of sugary drinks. They end up getting insulin resistance and a lot of pathologies related to diabetes, and in turn, higher risk for cardiovascular disease. So that's something that you have to keep in mind. Um, Getting back to the issue of women, in women, it is the number one killer worldwide. This is very important, and we have to be aware and we have to look for certain signs and symptoms so that we are aware of what's going on. Um, a lot of people report, a lot of people report upper jaw pain, neck pain, a stiffness in the back, in the jaw, in the neck, and then also shortness of breath. If you're getting shortness of breath, um, you need to get that checked out. Also, cold sweats. Some females get cold sweats as well at night, and then they also get unexplained fatigue. If you're getting tired excessively, you need to have your cardiovascular system checked out because that's a sign of not getting enough oxygen. When you don't get enough oxygen, then you feel kind of fatigued all over. And then also another telltale sign is sudden dizziness or lightheadedness that occurs often for you. That's another sign of not getting enough oxygenated blood to your brain. So that's something to look for. And then also nausea or vomiting, excessive nausea or vomiting, which you can attribute to a stomach flu or some type of virus, then that has to be checked out as well. Um, for every woman that has breast cancer, there's 7 women that have heart disease. So that's to put it in perspective for females. It's very important because um, 7 times more women die of heart disease than of breast cancer, and we hear about breast cancer left and right because it's promoted and it's marketed. There's awareness on it very well, but heart disease in women is not. People don't associate it with it. So what can women do to kind of decrease the chances of getting heart disease? It's very important. Number one, to eat a healthy diet. Eating a healthy diet nowadays, it you want wholesome foods. You don't want foods that have been processed. You want foods that are real foods that are coming from sources that are clean and pesticide free. Organic things are good as well if you can get your hands on them, as well as staying away from the processed and sugary foods. And then also the types of foods you eat. You want to eat foods that don't burden your body and your cardiovascular system. Specifically, you want to have red meat in a limited amount. You want to have carbohydrates in a limited amount. You don't want excess carbohydrates. You want to keep it all balanced in the middle. Too much of anything is not good. So you got to look at your labels, read the labels, see if there's added sugar in your cereals and in your grains that you take, your oatmeal, things like that. I would stay away from those kind of things and opt for fresh fruits and vegetables and things that are from the earth and that are wholesome. Those are much, much more easier on the body and they decrease the likelihood of disease as well, provided that they're good fruits and vegetables and they're nutrient dense. It's important to keep in mind where you get your food from. And then, of course, exercise is something which is very important for cardiovascular disease. Recommendation is to get at least 3 times a week where you get your heart rate above the normal 120, and that you're sustaining that for 20 minutes straight. That helps with your uh, cardiovascular system and keeping it in check in terms of keeping it healthy and functional. As you know, um, that's those are things that we can do, right? You control the environment, you control your intake of food, you control your behavior. Things that we can't do anything about is a family history. So some people have a family history of heart disease. So if you have the family history, you have to kind of research it and know it so that you can let your offspring know and let your loved ones know so they can be aware of it and look for signs and symptoms. And then once you do that, of course, then the other part is to regularly go to your doctor and get screenings. If you do have a familial history of cardiovascular disease, it's important for you to check yourself out yearly. Make sure that your carotids and your heart. You get a stress test. Make sure there's no plaques. Make sure that your valves and everything are functioning properly. So you have to be an advocate for yourself and ask your family doctor and tell them that, hey, this, my uncle or my dad or my sister or my father or my someone has heart disease in my family, and I want to make sure that you're checking my heart so that I get ahead of it and take care of it before it comes about. And that's what you can do. 15 to 20% is biological and hereditary. The other 85 to 70% is what you do in your environment and how you live your life and what your intake is in terms of food and drink. And of course, at this point, everybody knows, alcohol and smoking contribute very negatively to heart disease. So this is something which increases your chances and the probabilities of heart disease, by a mile. So if you're someone that drinks regularly and smokes regularly, it's heart disease and other illnesses too, like cancer, especially if you smoke, are things which you increase the probability of getting. So that's something that you want to slowly stay away from and cut off if you're doing. Um, the other risk factors, okay, for CVD or cardiovascular disease, um, when you go to your doctor, they'll do tests, they check your blood pressure. High blood pressure is a risk factor. If you have high blood pressure, it is very, very important that you take your medications, you make those lifestyle changes that decrease your blood pressure, because that is directly correlated with cardiovascular disease and incidences like stroke or heart attack. That's something to keep in mind. High cholesterol. High cholesterol is also a factor which influences cardiovascular disease and increases your probability. But there have been studies on cholesterol that um, people that take the medication for cholesterol and people that don't, they get the same rates of stroke and heart disease. So that's something to be researched more. And we're still waiting to hear more from the scientists on that to see exactly what the effects of cholesterol are. A lot of functional medicine doctors recommend that instead of taking all these with your food, all these seed oils, it's better to use olive oil. It's better to use natural full fat for your body and for your cholesterol. It's better to use ghee for cooking in moderate amounts, obviously, but it's better than the saturated or polysaturated seed oils. Seed oils are not natural; they've been extracted and they've been processed. So because of that, they're not as healthy as the natural fats that you can use. If you can use natural butter to cook with, natural butter, real butter, that they say is better than the seed oils that are now extracted. Avocado oil is another oil that's been utilized as good fat. That's good for you, and that's something that people utilize now, and that's where the research is going towards. Um, of course, physical inactivity, sedentary lifestyle is another risk factor for heart disease. And then also air pollution. Air pollution, if you're in places where, for example, if you live next to a refinery, studies have shown that there have been more cardiovascular disease and lung disease in people that live closer to a refinery. So your environment does affect you. And when you're in places, you want to be places where you can get ventilation and you get aeration, you get good oxygen, and you're not enclosed in a place where you might smell chemicals and such. That's something to keep in mind. And then, of course, unhealthy diet. I mentioned before, the fast food processed diet is not something that we should, you know, uh, have so often. It is better to have whole foods that are cooked at home rather than having corporations cook you food and give it to you, because they're in it for mass production, and they don't really care about the nutrients or the nutrient density of your foods. So you're not absorbing any good uh, micronutrients and vitamins from those foods. I mentioned before, if you have diabetes, that's also a risk factor for cardiovascular disease, as well as drinking and tobacco use. These are all known risk factors for cardiovascular disease. Also, kidney disease too. Those who have kidney disease are also prone to higher rates of cardiovascular disease. Cardiovascular disease accounts for, as I said before, a third of all deaths across the globe. That's one third. So 1 out of 3 people who die in the world have passed away from cardiovascular disease, and greater than 75% of cardiovascular disease deaths take place in lower socioeconomic households and families. So this is something which is something to keep in mind. In middle and lower income countries and families, regardless of location, that's where 75% of the heart disease takes place. And that in turn translates and tells us that it's the food choices and the types of foods that are bought that attribute to this heart disease over time. So the more processed foods, the more sugars, the more non-natural foods that you're taking, anything that's been or fried and not grilled or baked, then that's going to cause more problems for you. So I encourage you to look at your food first as your medicine, and change that food and then lifestyle in terms of exercise and intake of types of things that you take in terms of your supplements, and then also, of course, activity and behavior. Right, exercise is very important, and things that you can do to increase your longevity in life and decrease the cardiovascular risk. That is very important. Of course, smoking and drinking, it's much better to stay away from that, because those things are detrimental in multiple facets of health. So that's something which is known, and we all um, have seen that, and we see that daily and daily out. So those are some of the facts and figures. Getting back to functional medicine and what it requires in terms of the root causes. The root cause of cardiovascular disease is inflammation. So inflammation, anything that can drop the inflammation in the body, is good for your cardiovascular outcome. It's very important. Always check the medications that you're on with your doctor. Go over them periodically, so that you're not on medications for an extra long time for no reason. You have to check and ask them, say, hey, doctor, why am I on this medication now? It's been 3 years, it's been 4 years. Can we adjust it? Can we get rid of it? What's going on? So you have to be that advocate for yourself. And that's something very, very important to keep in mind. Those are the things that I wanted to kind of discuss. We did discuss the types of heart disease in a previous show. There's the coronary artery diseases, which are the arteries around the heart, which support and pump the heart. And then there's the peripheral diseases, which are all the cardiovascular diseases that have to do with uh, the functioning of blood getting to the organs. And then, of course, you have internal diseases of the heart muscle itself, as well as, like cardiomyopathies and heart failure. And then, as well, you have the valve diseases, which are the specific valves of the heart itself. The valves might get calcified, or they might decrease in functioning. So those have surgical interventions. But in general, if you keep yourself hydrated and you balance your body in terms of its nutrients and vitamins, you shouldn't get calcifications. Oral health is very important for heart health as well. If you're taking care of your teeth and gums regularly, that too will increase the quality of your cardiovascular system. So those people who have bad oral hygiene, they have a higher risk of getting cardiovascular disease, and they get things like myocarditis, and they get endocarditis and endocarditis. So these things come about from bad oral hygiene, because anywhere your blood travels, especially in your gums, and if you have bacteria, things that are taking place, that bacteria can transfer into your heart and on the valves of the heart, and they can cause major problems for you. So I recommend, in terms of oral hygiene, although you brush and floss, I would highly recommend getting a non-alcoholic mouthwash and using it at least 3 to 5 times a week to make sure that the bacteria that are in the mouth are getting taken care of as well, because you don't want that bacteria to be traveling into your um, internal organs like your heart, because that does create cardiovascular issues for you. Um, Please comment, please share this video with others so that we can increase awareness about heart disease. It is the number one disease in the world, the number one killer in the world, and we can get ahead of it by the things I mentioned. I hope you've enjoyed this quick program, and if you have any questions, please feel free to comment, and we'll see you next week, and have a wonderful, wonderful week. Take care.